According to the American Diabetes Association, 25.6 million people in the United States have diabetes. Of that 25.6 million, over 7 million are unaware they have diabetes. African Americans make up 12.6% of all diabetes cases, compared to Hispanics at 11.8% and whites at 7.1%. If African Americans compose 17% of the U.S. population, the question is, why are they the ethnicity that has the highest percentage of diabetes diagnosis? So the following is a health message that describes the prevailing knowledge and attitudes that might explain why this health disparity has occurred and potential strategies to remove it.
We're here today exposing community residents to resource information that hopefully will lead to healthier outcomes. So we're introducing concepts like how to garden on your deck or your porch, how to incorporate basic fitness techniques into your everyday lifestyle, how to cook healthier, and we are also incorporating the health fair component, whereby we do have vendors and practitioners here to provide those health screenings that people typically may not be able to access. So, when we think about mind, body, and spirit, it is just a natural fit that faith-based institutions such as West Eastern Church of Christ, Meharry Medical College, HBCU Wellness Project, work together to achieve what really ultimately is the same goal, and that is to have a healthier outcome.
Diabetes, if I'm not mistaken, has something to do with the blood sugar in individuals and has something to do with, having low blood sugar, if I'm not mistaken. Not having done too much research on diabetes, but that's my understanding.
Sugar has something to do with diabetes. I think salt has something to do with diabetes. In other words, something ain't mingling right in the body. The cells or something ain't connecting. And that's what diabetes is.
Diabetes, I think, is an imbalance of sugar in the blood and in the body. And in order to balance it out, you have to take a shot to balance the chemicals so that your body doesn't be damaged.
Well, I guess if you eat starch, I guess, and I don't know what type of sickness you have with diabetes, because a lot of people have diabetes and don't know they got it. And I guess I would be one of them. But I usually go for checkups, and the doctor always tell me that I don't have it. So, but I don't know the sickness of it. I mean,
diabetes is, I know it's a disease that affects your blood sugar. I should be more informed about it, but I know it affects your blood sugar. You have to watch the intake of what you eat, as far as like candy and other things like that, as far as with your food.
It seems like it's the result of insulin not being used by the pancreas to break down sugars. And when we say sugars, we are talking about complex sugars and simple sugars. It seems like that the people who have it and it's not treated, it causes necrosis of tissues and cells. Now, the necrosis is simply the deadening and hardening of these tissue. It affects the circulation. It certainly would affect the oxygen exchange between the cell and the interstitial spaces. It would cause the dead tissue to be affected and ultimately poisoning the whole body if it's not treated.
Diabetes is simply defined as a disease state in which there's too much sugar or glucose in the circulation. It's very important that a patient who has diabetes that they control their blood sugar, that they check their blood sugars. Patients who have diabetes should have a glucometer, which is a machine where you can check your blood sugars. You should have your you should check your blood sugars not only before meals, but also after meals. And there are certain parameters in which your blood sugar should be both before meals as well as after meals.
Pre-diabetic means that you've gone to the doctor, you've had an A1C testing done, and I'll explain that in a moment, and your numbers are not high, not over 6.5, but they're very close to it. So you're at a higher risk of developing diabetes. The A1C is a test that they do that can determine the average amount of sugar in your blood over the last 90 days. This is the most accurate test because the blood glucose levels, which they normally would test, only test about what's going on in the last 24 hours. But the A1C test gives you a full picture. It's like giving a whole story about what's been going on in your body for the last 90 days. When people go to a health fair and they are doing a blood glucose test, which is usually the most common test performed at health fairs, you want to definitely find out what their blood sugar levels are, and regardless if they're fasting or not, if they're too high, then there's a problem. And what we usually try to tell people is if your blood sugar levels are registering higher than the range, which usually for fasting you want it at least 90 or lower, and for non-fasting you want it at least 120 or lower. Fasting means that you've had nothing in your body for the last 8 hours, and non-fasting means that you have had something.
I believe it's to be African Americans because we eat a lot of fried foods.
Well, they do say black people, but I don't know. They said black people, but you know what? It could be all races, really.
I would say African Americans.
Why do you say that?
I mean, my grandmother was diabetic. A couple of my uncles are, and you hear about diabetes more so amongst African Americans. Well, I've heard more, as far as African Americans having diabetes. So.
I think probably the black races.
Why do you think that?
Well, because we overweight. We don't eat the proper type of food. We do not exercise right.
We should have control. I hate to say this, but are we a little bit out of control on our eating?
Diabetic-friendly menu that we'll be creating today consists of a turkey meatloaf with a garlic tomato sauce, braised collard greens, which will have a traditional familiar flavor but done in a very non-traditional way. And we'll also pair the entire meal with a butternut squash and roasted red peppers.
The first dish is turkey meatloaf. Listed to the left are the ingredients for this recipe. Combine all ingredients, then mix well. Place mixture in the middle of a 14 by 12 piece of foil and roll into a tubular shape. Place into 375-degree oven and bake until internal temperature reaches 180 degrees, approximately 30 to 45 minutes. The second dish is braised collard greens. Listed to the left of the screen are the ingredients for this recipe. Add stock and garlic to a large pot. Bring to a simmer, then add greens. Blanch for 15 minutes, then add crushed pepper and salt to taste. Add oil to warm frying pan, then add onion and saute until browned. Cooking time, approximately 4 to 5 minutes. With fork or tongs, add greens from pot to pan with onions and continue to saute for 3 to 4 minutes more. Our third dish is diced butternut squash. Listed to the left are the ingredients for this recipe. Add stock and squash to pot over medium heat. Cook until squash is tender, approximately 5 minutes. Add remaining ingredients and remove from stove.
It has been determined that with the ADA, African Americans have a higher prevalence of diabetes. Now, back in 2010, there were 26 million people with diabetes. That is an increase up from 2003, which is 18 million. Out of the 26 million, 3.2 million are African Americans. They have now determined that in the children that were born in the year 2000 are more likely to develop diabetes, and the ratio is 1 to 3, but they're saying for minority children it's 1 to 2. So that's every other child that you look at will have diabetes if lifestyle changes and nutrition changes are not implemented. Diabetes has affected me both directly and indirectly. Just about 4 or 5 years ago, I went and had a physical done, and that's where I found out that I was what you would consider pre-diabetic. I had an A1C that was at least 6.5, and my doctor wanted to put me on medicine, but I asked to do lifestyle changes. And at that time, the first thing I did was a food diary. That allowed me to see that I was averaging about 3,000 to 4,000 calories per day and over 200 carbohydrates per day. And that didn't even include the sugar that I ate. I was on food stamps, so I had a very limited budget. I had very low resources, but I had to decide if I wanted to make better nutrition choices by choosing fruits and vegetables over just sugary foods. I took sodas out of my diet completely. I took all sugars out of my diets and carbohydrates out of my diets. And once I realized that here I am 3 and 4 years later, and I am 150 pounds smaller than what I used to be, I really realized that it can be done. I have a what done it picture, and everybody has to have a shock factor. And even when they told me that I was pre-diabetic, that still wasn't my shock factor. It was when I went on a girls trip and I developed my pictures, and one of the pictures I looked at them and my thigh was a lot bigger than what it really should have been. And that was the what done it, and it made me step back and say, what have I become? What am I doing? Why am I here? Why am I making these type of choices? I just said, if I can just lose 1 pound this week, then I've done good. And then 1 week turned into a month, and a month turned into 6 months, and 6 months turned into a year. And before I knew it, I had dropped all of the weight.
There is an enormous disparity in predominantly African American communities called food deserts. They are prevalent in rural as well as urban areas and are more prevalent in low socioeconomic minority communities. If we specifically take a look at an area in North Nashville, Tennessee, between Tennessee State University and Farmers Market. Tennessee State University is 2.6 miles to the nearest grocery store or farmers market that sells fresh produce. For someone that relies on public transportation, a trip to the grocery store could take more than 2 hours. 3 blocks from the farmers market is Kroger, with a minimal organic food section. Kroger and the farmers market sit on the line of Germantown and North Nashville. The socioeconomic level of North Nashville is described as poverty to middle-class Americans. The closer to Germantown, the residents are middle class to upper middle class. If we take a closer look at another area, West Nashville, where West End Avenue merges into Harding Road, residents of West Nashville have access to 3 grocery stores less than a full city block from each other. Publix and Harris Teeter are directly across the street from each other. Kroger is 1 block west of Harris Teeter and Publix. All 3 of these grocery stores contain an organic food section. The socioeconomic level of West Nashville residents would be considered upper middle class to wealthy Americans. Access to transportation is not an issue. Food deserts is not just a Nashville problem. This disparity occurs throughout our nation in low socioeconomic communities. Access to fresh produce continues to be a huge challenge along with affordable, healthy foods. Meanwhile, we are learning that prevention is key in order to fight diabetes.
Both of my mom's parents have diabetes, and they both have to take the shot.
Yeah, I have two sisters that has diabetes.
Grandmother was diabetic, but her case was kind of mild from what my dad used to tell me as far as the stories he could tell me when I was a kid. But nobody with any major complications with diabetes.
Yeah, my wife, she has type 1 diabetes.
My sisters are both diabetics, and I have a brother that's a diabetic. In order to live a healthy life, I would think a diabetic should, number one, watch what he or she eats. And the reason is because what we eat can affect not only the body, but it can also affect the attitude.
I think that sugar has a lot to do with it. So again, from my understanding, just making sure that not too much sugar intake and not taking in too many chips, too many fatty foods such as pizza, so things of that nature, just trying to stay away from that kind of helps you live a healthy lifestyle.
They said 30% of exercising should help you not to not have it. And I guess you have to not eat so much of a starchy food. And I try to not eat so much of that, and I guess grease and salt. I really don't care for salt now. I used to, but I really don't. I started years ago, about 15 or 20 years ago, not eating very much salt. And I try to not eat salt.
Avoid a lot of starchy foods like potatoes, a lot of greasy foods, basically, and eat more vegetables to maintain a good blood sugar.
A person can live a very full and productive life if he or she really controls their blood sugar, uses the glucometer, sees a doctor on a regular basis, as well as follows a good diet and exercise, and using any medications that you may need in order to get good control of your blood sugars.
The ADA has a program called Live Empowered, and it's a nationwide program, and we do have 3 core events that happen under Live Empowered. First, we have Diabetes Day, and that is just where your churches and communities will take out time in their sermons or messages to bring about the awareness of diabetes and its serious complications. Then we also have Diabetes Now. Diabetes Now is an educational annual event that we do where we bring about the awareness of diabetes, and it is everything you ever wanted to know about diabetes with the prevention and management, including living healthy. And then also we have Project Power. Now Project Power is a module that the churches, it's a faith-based module that churches can incorporate. We also have workshops that bring about the experts. So this year we're going to have a panel that would include an endocrinologist that will help kind of clear up some messages about diabetes. We'll have a urologist because sometimes sexual health is a complication of diabetes. We have an oral surgeon that's going to come in, as well as a ophthalmologist because retinal is also a complication of diabetes. And then we have a podiatrist, which will definitely talk about the feet and how the feet are usually the first to be affected when diabetes is left unmanaged.
It's important for diabetic patients to consult with a podiatrist on a regular basis because diabetic patients are at increased risk of certain complications from diabetes, such as infections, gangrene, which can all lead to amputation. And usually when I have patients in my office that see me on a regular basis, I do a lot of diabetic foot education with them. And I'm able to get them on a comprehensive diabetic foot care program. I see them 2 to 3, sometimes 4 times a year, and I'm able to look for things, warning signs that I see that we can make sure to attack at that time to prevent things like amputations. Because just because a person has diabetes does not mean that they have to have those the complications from diabetes. If we can get on them early, we can prevent those things. Some of the procedures that I use as far as preventive care when the patients come to my office are a good diabetic foot exam. So I do a lot of education with patients. I give them a lot of materials that they're able to take home with them that reinforce what I do in the office. So actually, when I'm here doing my diabetic foot exam on the patients, instead of just doing it and having the patients look at me and watch what I'm doing, I actually explain it to them. The diabetic education is really important.
So for patients who's like, I have diabetes, okay, it doesn't hurt. You have hypertension, it doesn't hurt. But just over the time, over all the years of having those diagnoses, you are killing the blood vessels to your kidneys. And after a while, it just doesn't work. It doesn't filter anything. And your body will back up with all these toxins, and you will feel horrible. Your legs swell, you retain more water and more salt, you just generally don't have an appetite, you just do not feel good. Most of them are nauseated all the time, so you don't want to eat. They do lose some weight. Some patients do gain a lot, but it's fluid weight, it's not good weight. And then you're short of breath, and then you end up going to the emergency room. So you're here, and all of a sudden, oh, my kidneys have completely stopped. Really, how did that happen? Well, just over time, just not going to the doctor, getting your protein levels checked, in your urine, your labs drawn, checking your BUN and creatinine. There's something called a glomerular filtration rate that monitors how well your kidneys are functioning. When those numbers start declining, you need to watch what you're doing, get regular checkups with your doctor. Because once your kidneys go, you don't have a backup. This is their kidney that is filtering their blood, the toxins out of them while they're on the machine. It filters their blood probably about 19 liters, so constantly is pushing and pulling toxins from their body. Everybody has a prescription. Instead of prescribed time, we have a pre and post BUN, which gives us a number we call a K2V. We want that number to be 1.3 when we do 2 lab values during the month. So that predicts your time. And on average, most people's time is 4 hours. At this machine, we can take off at the most 6 liters of fluid in about 4 hours. Every patient is different, but that's a lot of fluid removal. If you have to get that much off, you will. Generally, they usually cramp toward the end. Because dialysis is like 90% water. We check our water every 4 hours because chlorine is really bad for dialysis patients. They can die if they get exposed to chlorine. Exercise and diet doesn't change once you start dialysis. It's just a different type of diet. Renal diet is not the friendliest, easiest thing. Just don't drink milk, or your tomatoes and your potatoes have to be soaked, before you eat them. No brown beans, your wheat bread, all that changes. There's a humongous difference in a normal diet and a renal diet. Peritoneal dialysis is you will be able to take your bag to dialysate with you. And if you're on in-center dialysis, they have to set up your dialysis at another facility. We fax a lot of paperwork to them. They accept you or not. You may not get to go because you shouldn't go without your dialysis. And then the other one would be the in-center or home hemodialysis. They can travel with that little smaller machine, and it makes it a little easier for them to travel from place to place. This is a 15 gauge needle, which is the average needle size for most dialysis patients, that helps get the body clean, basically the blood going in and being returned through another one, and there will be 2 needles. And they do start out smaller when you first have your fistula, but our goal is generally to have a 15 gauge needle. And this is not, in the hospital you have a 20 gauge needle. This is a lot bigger than this. This does hurt. But generally they do get used to it over time, but in the beginning, this is not what you want to do. You do not want to be on dialysis, having to have needles at all. If you can watch your diet, exercise, go to the doctor, get your labs checked, get your urinalysis done, you do not want to do dialysis. The average lifespan for our clinic is about 7 years, once you start dialysis. But we do have some patients that have been here 15 years. Actually, we have one patient that's been here 30 years. He started when he was really young. But at the same time, blacks, not sure why, do live longer on dialysis than other races. There's not a rhyme or reason to it or any scientific, value they can put to it. It's just something that just happens. It's a hard life, but at the same time, but most people, once they get started on dialysis, they do adjust to it.
Being healthy means to me just kind of looking at the food pyramid and taking, usually trying to go with all the recommendations as far as the 6 to 10 servings of bread, or the 2 to 4 servings of any other type of vegetables or fruits. So I think, when you're able to use the food pyramid as a guide, that's the best way for you to live a healthy lifestyle.
Well, healthy, I guess if you can sort of get around and I guess walk a little, and do your exercise, and I guess eat balanced meals, and feel very well. Now, one thing about it, now I do suffer with arthritis, so most of the time I might not be feeling too good because that arthritis will have you not feeling good at all. So that's the only thing that gets me down is arthritis.
Well, to me, it means staying in good shape, eating the right type of foods, and exercise.
It means that you're going to have a good time, and you're going to be able to go places that you usually wouldn't go. It might help your mental ways you do because you're healthy, you know, because I kind of suffer with that now at my age. But I'm still putting one foot in front of the other, you know. As far as my age is concerned, I'm glad I'm doing what I do.
Being healthy to me means not having to worry about, am I taking my medication such and such time, or being able to go out and do things without having to worry about, am I going to hurt myself, or being able to play around with my sisters, you know.
Healthy means life, being able to do and to go and to do things, you know. Oh, that's what it's all about, a healthy body and a healthy life. I may, like, just for instance, I'll be able to smile at people. I'll be able to go and to come and be able to walk because, you know, like I said, some people, I'll be able to walk without, what shall I say, crutches or something like that. Oh, it means life. Oh, that's what it's all about, a healthy body and a healthy life.